tongue is a muscular skeletal structure located on the floor of the oral cavity. It is the primary organ of taste and plays a key role in the initial phases of swallowing. Let's break it down. The tongue has several parts: the root, the tip and margin, the lower surface, and the dorsum, which is the upper surface. Now, focusing on the features of the tongue. On the dorsal surface, we find papillae. These are irregular projections that give the tongue its characteristic texture. There are four types of papillae. Filiform papillae, small, conical projections that do not contain taste buds. Fungiform papillae, found mostly around the edges and scattered across the dorsum. They are associated with taste buds. Valate, also called circumvallate papillae, arranged in a V-shaped pattern near the border between the oral and pharyngeal parts of the tongue. Foliate papillae, located along the lateral aspects of the tongue. Next, taste buds. Taste buds are barrel-shaped structures embedded within the epithelium of papillae, except for filiform papillae. They contain three main types of cells: sustentacular, or supporting cells; taste, also called gustatory cells; basal cells. Taste pores are the small openings through which dissolved substances interact with the taste cells. Now let's discuss the muscles of the tongue. There are two major groups: intrinsic muscles and extrinsic muscles. The intrinsic muscles originate and insert within the tongue itself. They are four paired muscles named according to the direction of their fibers: superior longitudinal, inferior longitudinal, transverse, vertical. These muscles alter the shape and size of the tongue and are all innervated by the hypoglossal nerve. The extrinsic muscles connect the tongue to surrounding structures. Genioglossus, the largest extrinsic muscle. It arises from the genial tubercles of the mandible and inserts into the entire length of the tongue and the body of the hyoid bone. It helps in protrusion and depression of the tongue. Hyoglossus arises from the hyoid bone and inserts into the lateral aspect of the tongue. It assists in depression and retraction. Styloglossus originates from the styloid process of the temporal bone and inserts into the lateral tongue. It helps in retraction and elevation. Palatoglossus arises from the palatine aponeurosis and inserts into the tongue. All extrinsic muscles are innervated by the hypoglossal nerve, except palatoglossus, which is supplied by the vagus nerve due to its association with the soft palate. Finally, the nerve supply of the tongue. For the anterior two-thirds, general sensation is supplied by the lingual nerve, a branch of the mandibular division of the trigeminal nerve. Taste sensation is supplied by the chorda tympani branch of the facial nerve. For the posterior one-third, both general and taste sensation are supplied by the glossopharyngeal nerve. Now, a clinical correlation. Tongue tie, also known as ankyloglossia, is a congenital condition in which a short, tight lingual frenulum restricts tongue movement. It may cause breastfeeding difficulties, speech problems, and oral hygiene challenges. Treatment is usually by a simple surgical procedure. That's the tongue: its structure, features, muscles, nerve supply, and clinical relevance. See you in the next lesson.